Well, here we are at the Tabor Hospital again for the 2017 Telethon, and we're so grateful for all the donations and everything that everybody is donating this great day, and as we look to further the impact that the hospital has and the Chinook Health Foundation has in our community. So I'm here with Andres Postmas, who is the site manager for the Tabor Hospital. And Andres, we're going to look at some equipment today. Maybe you can briefly describe what we're going to be looking at, and then we'll see where it goes from there.
Sure. So I also would like to thank all the donors for their generosity. We have received some fantastic equipment at our site, and we'll talk about a few. First of all, there's a Irby cautery machine. It's a machine that helps stop bleeding during endoscopy procedures. The fantastic thing about this machine is it has an argon gas option, and without getting too technical, there are certain procedures where a certain delicate situation that gas makes it much safer to stop the bleeding, and it's been a good asset to our capabilities here. Also, we have since about a year and a half a visiting orthopedic surgeon come to Tabor who does arthroscopies to the knee. For that, the foundation has made it possible for us, and I guess it's right behind us, but there's a arthroscopy tower with all the video equipment, monitors, and all the actual scopes that go along with that in order for us to do those procedures. The foundation also purchased for us in our recovery room patient monitors to safely monitor our patients when they are recovering from procedures. And then later on we'll see in the operating room there's the operating room bed or table, so to speak, that has been purchased, and a fantastic warming cabinet that will warm our blankets as well as our IV fluids. And then there is a state-of-the-art intubation tool. And intubation is a procedure done prior to surgery to put a breathing tube into a patient, and this particular machine visualizes that really, really well. It's also a very good teaching tool, but it surely is making the whole procedure much safer for the patients.
Well, thank you, Andres. I know that equipment is very expensive, and maybe you can give us an idea of how much money has to be spent on equipment like this that is raised from funds donated to the Telethon.
Sure. So, like the Irby machine we talked about earlier, the cautery machine is in the like $40,000 range. A very expensive piece of equipment we have is the arthroscopy tower with all the scopes. Mind you, it's not just a tower, but that total purchase was in the $150,000 range. And the OR beds or tables are about $25,000 a piece. So yeah, none of it comes really cheap. The CMAC intubation machine is between $30,000 and $35,000. So it's great stuff, but it sure takes a significant amount of money to purchase.
Well, I think that does, and again, thank you everybody for donating this great day to the hospital foundation and to the hospital itself, and this is equipment that is well needed in our community.